Hi, my name's David Lisle. I'm a radiologist in Brisbane. I'm in private and public practice up here in Brisbane. I'm a general radiologist. Recently, I've been interested in becoming involved in this new national lung cancer screening program, which sounds very worthwhile and really quite interesting. So as part of that, I've been very happy to register for the webinars that have been going on. We've had 4 of the 5 webinars now. And a couple of weeks ago, I was very privileged to attend a workshop at the Royal Brisbane Hospital, which was just provided an absolutely excellent review of the whole screening program. So just to talk about the workshop briefly, they really were just terrific. And they provided, I guess, an overview of the program and a bit of a refresher on the clinical webinars that had occurred up to that stage. So the first one was sort of an introduction to the program, how it's all going to work. The second one was a really excellent overview of lung nodules and how the program is going to work in terms of assignment of risk categories for various nodules based on appearances and growth, and the appropriate management guidelines that flow from that. And then the third workshop that was reviewed was the one on AI assistance, and including volumetric measurement and so forth and so on. Then there was, I guess, what will be a preview of the final webinar that's happening, I believe, on the 29th of April. And that's about the additional findings that we see on chest CT and how to deal with those and manage those. And so that was great. And then we moved on to the workshop part, which was we all had access to our own workstation, and we looked at lots of cases and present opinions on those, and the experts told us what we were looking at and how to deal with those, and it really was fantastic. And I've done a lot of these individual workshops on various topics over the years, and it really is a great way to brush up and to learn and to feed off the experts, and that was a very helpful. The selection of cases was excellent, and I guess if I've got any complaint at all, it was just that it finished too quickly and we didn't look at enough cases. So, and then that's always the case when you look at these, when you do these workshops, you always sort of want more. So after doing that, as a general radiologist, I feel much more confident about taking part in the program. I generally feel more confident looking at chest CTs, even though I've been doing the job for 30 odd years. As we all know, you can always learn stuff and brush up. And so it really was a fantastic revision on chest CT, if nothing else. I would find it hard to imagine how anyone could actually be involved in the program and not have done at least the clinical webinars. And I really would strongly recommend that anybody go and do the workshop as well. It's really very, very worthwhile and very, very well run. You end up not just with a bit more radiological expertise, but a much clearer idea of how the program is going to work, how it'll fit into your individual practices, what might be the AI assistance that's required, etc. To sum up, highly recommended, and I think you should all attend.